There are side effects. Memory loss is the most significant, but full memory usually returns after the treatment cycle is complete. A great challenge facing scientists is finding ways to see depression in the human body. It's no easy task.
The brain is an organ that's locked in a solid box. An X-ray of the head basically shows you bone.
But now, advances in medical imaging are allowing researchers to see past the skull and into the brain.
Over the last 15 to 20 years, there's been a development of tools that allow you to look at the brain in a way that we never could look at it before.
Scientists are trying to see how depression affects normal brain activity.
If somebody is at risk for the disorder or is actually living through it, certain parts of the brain are probably not working the way they would in someone who's not experiencing depression.
Understanding how brains manage moods and emotions is the first step to seeing depression.
There's probably a complex circuit in the brain that has to do with how you regulate emotions, how you take in emotional content, how you put it back out, how you form opinions about people in an emotional field.
Scientists are looking for connections between behavior and brain activity.
How does somebody handle emotional tone, emotional input? You yell at me. What happens in my brain? How do I take not only the vocal content and the words and the semantics and regulate it, but what do I do with your tone? What do I do when you get angry with me? What lights up and what allows me to respond to that or handle that content?
Okay, this first scan's about 3 minutes.
To see depression in the brain, they start with an MRI scan. It provides an X-ray-like image of the brain's interior. This is the orbitofrontal lobe, an area scientists believe controls moods and emotions. Researchers can't see depression in these pictures. They extract data from the images to create graphs which illustrate what chemicals are present and active in the human brain. Results are preliminary, but one substance, choline, which is essential for the production of cell membranes, has been found in abnormally high levels in depressed teenagers. Scientists hope this discovery will lead to the Holy Grail: improved diagnosis and treatment before the disease strikes.
The hope is that you can actually get in there and correct the functioning of cells that aren't functioning.
Today, the future of treating depression is here in the laboratories of the nation's drug companies. Pharmaceutical researchers are improving existing antidepressants and discovering new ones. The focus of their work are the brain's neurotransmitters, the chemicals that carry impulses from one brain cell to another.
Some of them are very similar to adrenaline, and everyone knows about adrenaline. It obviously affects your mood. You see some type of a dangerous situation, your adrenaline goes up, you feel excited, you feel up. And that's a similar situation that occurs in depression, except the opposite.
Neurotransmitters are the chemical messengers that carry impulses from one cell to another. Serotonin is not the only one. Two others are norepinephrine and dopamine. The malfunctioning of any of these may contribute to depression. When these transmitters fail to attach to the receiving neuron, important messages controlling our moods fail to get through. Scientists are focusing on the end of the neurons, called the receptors. It is here where neurotransmitters bind and complete the circuit.
We can actually take the receptors out of their tissues in the body, put them in a petri dish or a test tube, and actually see whether or not molecules interact with those receptors. Just simply, do they grab onto them or do they not grab onto them?
One drug manufacturer, Seprecor, is developing a promising new compound, an antidepressant drug with a triple mechanism, meaning it improves the functioning of all three transmitters simultaneously. Existing SSRIs only affect one transmitter at a time. That's an exciting development for people using antidepressants. As firms like Seprecor look to the future, The real goal is a better understanding of what causes depression in each of us.
So if you could determine what those different causes are, you probably can tailor individual therapies for patients that might be better suited.
While scientists search for better forms of treatment, depression persists. For the millions that continue to suffer, the key to survival is asking for help when you need it.
Have you been feeling suicidal today?
What's been going on for you?
Okay.
These are the Samaritans, a suicide prevention hotline. They wage the war against depression by answering the phone when the despairing call.
Yeah, it sounds like you are having a hard time.
Oh, I'm sorry that you're suffering.
Are most of the people who are calling, are they suicidal?
Most are not suicidal, although we assess risk on every call.
Are you feeling suicidal today?
Only about 5% are actually in acute risk when they call.
So most of them just need someone to listen to.
That's right. They've often used up a lot of their other avenues out there, and they need to talk to someone just to kind of feel some relief from their despair.
Ooh, that can be rough.
Is it okay if we listen in on a call?
Please.
What kind of things have you been going through? Oh. Oh. Yeah, I'm so sorry. That must be so frustrating. We get a lot of callers who use us sort of as part of their taking care of themselves. So it's not maybe the first time they've said, I'm struggling, or I'm depressed, or I have a mental illness. But we do get a lot of first-time callers who it's the first time that they've said, you know, I'm struggling with an issue in school, or I think I might be gay, but there's no one I can talk to, or I think I might have a drug problem. And I think just having someone not run away, not try to change the subject, validate what they're going through is real. By picking up the phone, we say we care, that we think they're worth something. Yeah, no, I'm glad that you do call.
What are some of the things you've learned about depression since working here?
One, that it can happen to anyone, that it can be totally debilitating, that you can hide it. We have a lot of callers who will get through their days, but are really in a lot of pain. Did you go to work today? What I've learned is that there isn't an easy answer to depression, that yes, sometimes medication helps, yes, therapy can help, yes, groups can help, but you need to sort of have people listening that really care.
Is that upsetting you?
Every 17 minutes, somebody attempts suicide. Among college students, it's the second leading cause of death. If you find yourself talking to someone who may be suicidal, there are do's and don'ts.
What stuff's been happening?
You don't want to give advice. You don't want to talk about yourself. You don't want to make presumptions. I think it's important just to let the caller take control of the phone call.
How hard is it for someone to pick up the phone and actually call you all?
I think it takes a lot of courage. I have a lot of admiration for our callers because I think they're struggling really hard and they're willing to take a chance.
Are you a little bit confused?
They're willing to open up and trust someone, even if it's just for 20 minutes, even if they don't use their name. They deserve someone to listen to them and to be there for them.
I'm glad that was helpful to you, Bob.
What's the most rewarding part of the job for you?
I think the most rewarding part is simply knowing that I helped. I know every time that I get off the phone that I've helped in some way because I've fulfilled a need. Our service is very busy. We get many calls a day, and so it's so important to be here and to be answering those calls. Oh, no, that's okay. Take your time. Who else are you going to call at 3 a.m. in the morning? They know that they can call the Samaritans, and there'll be someone there to take their call.
For most of us, depression is just a mood, part of a complex emotional cycle. But for some of us, depression becomes an illness. There are many effective treatments for depression, including medication and psychotherapy. Remember, the most important step is the first step, recognizing the need for help. For Body Invaders, I'm Kat Carney. Stay healthy.